Thank you very much, Sages, for the opportunity to present. Where's the button? Do you have the remote? These are disclosures. Also, the current system is pending 510K approval, but it does have a CE mark in the EU. The current landscape of minimally invasive surgery, both laparoscopic and robotic surgery, has been stagnant for the last decade since the release of the penultimate multi-arm system over 10 years ago. An assessment by surgeons and health system and OR staff has demonstrated multiple unmet needs. Shared amongst this group are the need for an increased access to minimally invasive surgery with advanced technological capabilities, the need for obtaining, recruiting, and retaining skilled staff, as well as the ability to reduce turnover and increase efficiency. Surgeons are seeking to improve ergonomics and stability, autonomy, and control during their operations. Health systems are seeking to lower cost and more appropriate resource utilization while maximizing margins in these increasing pressing times. There exists a gap between the current systems of conventional laparoscopy and robotic surgery. Based on geography, staffing, contracting, and reimbursement issues with equivocal outcomes, we believe that not all cases can nor should be done using a multi-port robot and can more effectively and efficiently be done using an alternate MIS model. There exists a need for an efficient, digitally autonomous system to fill this gap, this middle ground. We call it laparoscopy 2.0. The solution that we propose is the Moon Surgical Maestro Digital Surgical Assistant. This is a low-profile, intelligent digital first assistant robot. It has 2 gravity-defying arms to provide stable vision and retraction, utilizing off-the-shelf 5 and 10 millimeter conventional laparoscopic instruments or cameras. The system has 2 full-motion wristed and multi-articulating arms that are highly and quickly configurable and maintains torque on multiple patient anatomy, including those patients who are obese, and it has easy finger touchability to manipulate and reposition during the case. Attachment or coupling of the instruments or cameras to the devices is with a novel coupling device that accommodates standard off-the-shelf, commercially available 5 and 10 millimeter reusable and or disposable instrumentation or cameras. And again, it can position and maintain this position in extremes of positioning and or body habitus. But there's just one more thing. As Galileo Galilei said, and yet it moves. One of the more novel features that's being introduced, currently available only in the EU at this time, is a fully autonomous AI-based computer vision camera following technology. You dock the camera to one of the arms, and after acknowledging the tip of the instrument you want it to follow, it will center the screen and move the camera appropriately throughout the operation. No more clutching, no more hands, and no more yelling to the student to keep you centered. The aim of the study was to perform a feasibility study in a multi-center institutional trial in a diversity of soft tissue diseases. There have been over 255 cases performed in 2 continents with 4 surgeons. And we're currently at 9 to 10 procedures per week. And the case diversity is a mix of general, colorectal, bariatric, and most recently, gynecological procedures as well. These are some of the case distributions. These are pictures of the a digital surgical assistant in use. You can see standard laparoscopic instruments without any collisions for the actual surgeon and no need for a third assistant during the case. After only 210 cases being analyzed, the system only required approximately 3 minutes and 45 seconds of additional setup time, which is markedly reduced compared to other multi-arm systems. And you can see that there is a short learning curve with no differences in times compared to straight laparoscopic surgery. And this is across a compendium of different disease statuses. Conversion was low, requiring only conversion to manual laparoscopy or open surgery, but none of these were related to the device. So with over 200 cases performed worldwide, we were able to demonstrate a low conversion rate. Teams and surgeons were able to perform these operations independently after only 3 to 4 cases. No device-related safety events were noted. There was notably increased surgeon, resident, and OR team satisfaction without the need for dependence on assistance or static retraction. So what we present is the Maestro Digital Surgical Assistant. It's the first true AI surgical system with autonomous camera motion. It is a low-profile, low-footprint device with independent articulating arms that provides for improved access and availability of advanced laparoscopy worldwide, and therefore the ability to integrate this device into a diversity of environments, including outpatient ambulatory surgery centers, to provide more access to minimally invasive surgery to more patients at lower costs while maximizing margins. Again, it's a sustainable, efficient, digital, and autonomous operative platform delivering the benefits of surgical robots that surgeons love while preserving existing surgical workflow, technique, and instrumentation. Thank you very much.